every foreigner living here in South Korea, be it D2 for students, D4 for Korean language learners, E7, E9, F2, F5, and Korean citizens enjoy and have to pay the National Health Insurance Services. And to be honest, it's one of the best expenses I have here in South Korea. And in this video, I'll be explaining to you how was I able to get some benefits from this insurance and some real life experiences I had wherein the National Health Insurance Services saved me and actually my pocket here in South Korea. Hello, this is Justin, and I do a lot of videos and podcasts here in YouTube. And our topic for today is very important because I know a lot of you are planning to live here in South Korea, study here, and the National Health Insurance Services is one of the things that you have to consider. I mean, you're required to pay it. It's a safety net that a lot of legal residents here in South Korea are able to use and enjoy in case of emergencies. So, what is it about this health services insurance that makes it very unique? So, for the basics, it's a monthly expense that a lot of residents, and long-term residents, except for tourists, have to pay. So I think my monthly bill comes up to 150,000, 160,000. So the health insurance services payment is divided. So I cover 50% of my insurance. My company, the Korean agency I'm working at, is the one covering the other 50%. So before I receive my salary for the month, these expenses will be covered already and be paid by my company. So I don't really have to go to or probably do online transactions to do these things. And a lot of employed individuals have this set up because it's a mandatory thing. A lot of companies, before they even employ or onboard employees, they have to register these students, these employees to the health insurance services. So that's how it is paid. I think for students, you have to pay them on your own, and you can do bank transfers, and that's the easiest way, I think. You can also pay through like ATM, that you can do some options there for payment and then pay to cash. But for me, since I studied here for my Korean language classes up until my MBA program, I do the monthly auto debit, wherein the bank account is monthly deducted with half of the fee. Because again, as a Global Korea Scholarship awardee, I was able to get the 50% um, health insurance premium discount. So that's how it worked. And then, so what is covered for the health insurance? So I recently had experience having appendectomy, so wherein my appendix was removed. And throughout that surgery and hospitalization for almost for a week, the total bill came up to 6 million Korean won. I'm not sure. It's like probably a 5,000, $4,500, and in the Philippine money, probably 4,240,000 pesos. So that's a lot of money. And if I'll be able to pay it off my pocket, I would probably have to do it installment basis, although I have money to pay it, but it will be very big burden for my wallet. So the National Health Insurance Services, through my payment since arriving here back in 2021 until now, I was able to get some coverage and protection, and probably he was able to get some discounts. So when I received my final bill, it was deducted by at least 4.5 million Korean won. So that's a 75% bill reduction. I was able to pay up until 1.5 million Korean won, and that's it. I mean, from 6 million Korean won to 1.5 million Korean won. That's a lot of difference. Probably I was able to save from $4,500. I just paid $1,000, and that's including the hospital, the operation, the food during the recovery, and that's it. I mean, without insurance, I'll be paying $6 million, 6 million Korean won. But with the insurance, I'm paying 1.5. That's why, in all honesty, if you are like an illegal alien here in South Korea without a valid visa, I really feel bad and fear about any incident happening to them because the insurance cannot cover them. If you're not a legal alien or not a legal resident here in South Korea without valid visa, unfortunately, you cannot apply for insurances like this, and that's a big problem, to be honest. And again, these insurances help you and protect you when it's come to these kinds of challenges. And I hope a lot of you, if you're planning to move here or probably enjoy your life or work here in South Korea, you'll be able to, I mean, consider the value of the insurances like this. And in South Korea, also, if you already have the national mandated insurance, you can also avail private insurances on top of that. So currently, I am paying around 40,000 Korean won. I'm not sure how much is that in peso, but probably in peso, almost 1,600 pesos. I'm not sure how much is that in, but probably 20, $30. So that is for my teeth. So I'm planning to do some implant in the future. So with that insurance I'm paying up monthly, I'm hoping to get at least 70, 80, 90% discount for my teeth implants. And then a lot of discounts for tooth extraction, cleaning, these things. So you can also avail private insurances for procedures not covered by the National Health Insurance Service. So again, for example, procedures like plastic surgery, aesthetic related, are not included or covered by the National Health Services insurance. So, for example, when your rhinoplasty, LASIK surgery is also not covered. For the teeth, also, not majority of them are not covered by the insurance. But again, that's part of the plan. That's part of the process. So it's really a must that you have the government mandated. But if you have other things that you want to do, you may avail some privately owned or privately provided insurances, and that's also and perfectly fine. So, for example, if I had another medical insurance, I can get more savings on top of what I received from my national health insurance services. And to be honest, the NHIS is one of the equalizers here in South Korea. And what do I mean by this? Us foreigners living here in South Korea pay the same amount of insurance paid by foreigners, by Koreans living here in South Korea. Meaning, in all honesty, this is one of the reasons why I keep on saying that some of the benefits they receive should be at least extended to foreigners, especially if they've been living here in South Korea for a long period of time or in their specific visa bracket. Because imagine, I'm also paying the same thing they're paying, the same tax they're paying. And although I'm earning money from here in South Korea, but again, it should go both ways. So my only concern is that because in South Korea, they've been giving a lot of economic relief budget, like at least 150,000 per household, but only specific visa holders can avail such. So, for example, if you're a family or married to Korean or a refugee, I think these visa holders can get the same benefit from the government. But I'm hoping, like, I mean, I'm also paying taxes, I'm also paying the insurance. I hope they also extend such to us foreigners. But yeah, that's today's topic. Actually, I want to share this with you because, again, if you're planning to live here in South Korea, there's so many things that you have to consider. Probably the next topic I'll be sharing with you is housing, which is very important and a very timely topic to discuss because there's a housing crisis here in Seoul. Everything's getting expensive, and there's a lot of motives that you have to be aware of and check if you plan to live, find housing, and enjoy South Korea. Till our next video. Bye bye.